News Extra is next here on KNEB and brought to you by First State Bank. Here's Kevin Mooney.
Thank you very much, Dennis. Good morning, everyone. We mentioned there on the news at 7 o'clock we're going to talk about diabetes awareness, and in particular today we're going to focus a little bit on gestational diabetes, which is on the rise among expectant mothers. We have a couple of doctors from the Women's Center over at Regional West. We have Dr. Dorisa Polk, who is Chief of Obstetrics at the Women's Center at Regional West Physicians Clinic, and Dr. Cynthia Guerue. She is Chief of Pediatrics. So we welcome them, and we're going to talk, I guess, first with Dr. Polk. Let's just talk about exactly what gestational diabetes is and why it's so important for expectant mothers to be considering this and what's going on with this.
Well, gestational diabetes is basically diabetes that develops during pregnancy. As the pregnancy progresses and there are more hormones produced by the placenta, then you can see that development where women just aren't responding to glucose as they normally would, and they require higher levels of their own insulin to control it. It's important for us to be seeing these women early in pregnancy and knowing, one, how far along they really are. So establishing their care early helps to determine when they should be tested. And then doing the screening test sometime between 24 and 28 weeks so that we can diagnose them, we can get them established with a program where they're checking their blood sugars. We refer them to a dietitian, a diabetic educator, so they understand more about how to test their sugars and what kind of diet and exercise program can improve their control, and then decrease their risk for complications later on during their pregnancy.
All right. If they have diabetes right, before they become pregnant, obviously there's a bigger risk. Am I right?
Absolutely. So if a woman is a diabetic prior to becoming pregnant, it's important that she try and have good sugar control before she conceives, because that first trimester is crucial in the baby's development, and you can see different defects that are associated with poorly controlled diabetes, such as cardiac defects, defects of the nervous system and the GI system. So those women need to be aware of those risks and to be on top of it before they even become pregnant, ideally.
All right. So what happens after the 6 to 8 week test? You kind of monitor this. When the baby is born, what type of things does the baby show where you go, hey, we got to keep the baby here for a while because of this disease?
Yeah, so once a baby's been delivered, particularly if we know if mom's a diabetic, we typically will start monitoring their blood sugars. Certainly if there's no signs that mom had diabetes, and the baby will sometimes show signs of being jittery, and those will be some clues for us that we need to go ahead and start testing that baby. And that begins with a blood test for their sugar. So once a baby's delivered, baby has been used to mom having high levels of sugar, and once that sugar is taken away, the baby still has high levels of insulin, and that actually causes the baby's blood sugar to drop. Once the baby's blood sugar is low, that is not giving sugar to the brain, and that can cause problems with brain development if they do not have that sugar. And so we start monitoring them very carefully, and if they continue to show signs of low blood sugar, not being able to keep that blood sugar up with feedings, then often we have to admit them to the neonatal intensive care unit and treat them with IV glucose to maintain their blood sugars.
And that can go on for several weeks.
Well, the IV, we often can get their blood sugars controlled fairly quickly. Usually we can get them turned around in 24 to 48 hours with their blood sugars, but because of some of the consequences of mom having a high sugar during the pregnancy, sometimes those babies are born premature, so that can put them at higher risk of staying in the NICU longer. They're often large babies, which doesn't necessarily mean that they're healthier babies, and that can put them at risk for birth trauma. Sometimes they can have respiratory difficulties, and then also the biggest issue that keeps them there the longest is feeding difficulties. So these babies, although they're big and they look healthy and strong, they just can't coordinate their feedings very well. And so we can get their blood sugars under control fairly quickly, but they often don't have the coordination to eat, and that it keeps them there very longly. They have to be fed with NG tubes, and they're just very slow to come around. And yes, sometimes even if they're a term baby, they can be in the neonatal intensive care unit for 3 to 4 weeks just learning how to eat.
Yeah.
So.
Okay. All right. Very good. Anything else we need to talk about on this particular subject before we take a break here?
Well, I think it's important to know that those complications can be decreased and that babies can do better after they're born. There's lower risks of complications of the pregnancy itself if the sugar is well controlled. So women are testing themselves multiple times during the day. They have target levels that they're going to. And sometimes just diet and exercise can control that. Sometimes medication is required, for example, insulin.
Yeah. Okay. All right. We'll take a break. Be back real quick right after this.
Love touches everyone, both those who give as well as those who receive. For 36 years, First State Bank has been able to touch the lives of many in the Panhandle through our Gift of Love program, and this year is no exception. We invite you to share your love by picking a name from our tree of names or donating a new children's coat. You may leave your donations at either of our First State Bank locations, 2002 Broadway in Scottsbluff or 1540 10th Street in Guerue by no later than December 6th. All donations stay in the Valley. Won't you give? First State Bank, member FDIC.
All right, we're back on News Extra. We're talking about diabetes awareness with Dr. Cynthia Guerue and Dr. Dorisa Polk. I think she wanted to say something real quick before we maybe move on to something else.
Yeah, I sure do. Basically, looking at after the pregnancy, that those patients who have gestational diabetes have an increased risk of developing diabetes in the future, and about 70% of women can develop diabetes within 20 years, 25 years of their diagnosis, so they need to be screened after that. And I don't know if you wanted to talk more about just diabetes in general.
Yep. All right. Real quick.
Okay, so there's basically two different types of diabetes. There's type 1 diabetes and type 2 diabetes. So type 1 diabetes, which often is initially diagnosed as in the young age and often referred to as juvenile diabetes, is the body's inability to produce insulin. So it's a pancreas issue, and so that causes the blood sugars to be high. And some of the signs of diabetes are increased thirst, increased eating, and increased urination. So if you've typically not been, waking up in the middle of the night to use the restroom, that's one of the initial signs. And you can do some basic screenings like a urinalysis to look for sugar in the urine as just a very basic test to see if somebody has glucose in their urine. Type 2 diabetes is typically what we refer to as later onset, although we're seeing that a lot more in kids, right. And we're screening them a lot more for that. And so that is basically kind of resistance to insulin. So you have high levels of sugar, you have high levels of insulin, but the body's unable to use that properly. And so with the rise in obesity, which is one of the major risk factors, although your genetics is a high risk factor for that too, we are seeing a lot more of that as well. And they basically present with the same symptoms of increased thirst, increased eating, and increased urination.
Okay. If anybody has any more questions about any of these issues, they can call you guys at, what's the number again?
At Regional West Physicians Clinic Pediatrics is 630-1811.
All right.
And the Women's Center is 635-3033.
All right. Very good. Thanks, you guys. Appreciate it for coming in.
Thank you.
Yeah.